बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक वसल्लि अलैहि. Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is female patient, almost 30-year age, with history of SVD 13 days before. Now she is giving history of pain and tenderness in the right iliac fossa region for the last 7 days. So I am going to scan the right iliac fossa region. This is the kidney. You can appreciate that it is hydronephrosed, and this is the ureter. This is the ureter, and if we appreciate, what is this? That is passing anterior to the ureter and behind the lower pole of the kidney, it is dipping into the behind the kidney. So it is likely the inflamed appendix. So I am going to see the tip of the appendix. So this is the appendix. Going to follow it. I am going towards the pelvic region. Here we can appreciate, here this is the appendix, and if we closely observe, this is the right cornu of the uterus, and if we see the uterus, it is the appearance of the postpartum uterus, and this is the fallopian tube, and here this one is the appendix, which is adherent to the posterior aspect of the fallopian tube. Let's see in the linear probe to clarify further. So this is the uterine right cornua, and it is the fallopian tube edematous due to the postpartum, and this is the rounded inflamed appendix, this one, and this is the femoral end of the fallopian tube. And now we follow the appendix. And this is the appendix. I am going to follow it. Look here, it is adherent to the femoral end of the fallopian tube, and this femoral end is surrounding half of the appendix. And this appendix is now, I am going to see it. Here we can appreciate this appendix, this one. So this appendix is reached just posterior to the lower pole of the right kidney. Here this is the, and it is disappearing posterior to the right kidney, lower pole of the right kidney. So this is the interesting case that the inflamed appendix travel from the right subcostal region, passing beneath the peritoneum, and reaches the edematous fallopian tube, this one, which is due to the postpartum, and then it adheres to the femoral end of the fallopian tube. If we put the color, look at the hyperemic flow. So this is the case of Tubo-Appendiceal adhesion with acute appendicitis. Again, I am going to show you. This was the interesting thing I have seen first time. So for this reason, I am going to show you again and again. Here we can appreciate fallopian tube, this appendix. Look here, this one. And now this is the lower pole of kidney, this is the ureter, and it is dipping posterior to the lower pole of the kidney. So in conclusion, this is the case of acute appendicitis with tubo-appendiceal adhesion. Thank you very much.